So you have maybe a pet that is older or has a really bad history with the vet where they're very triggered, everything is very scary for them. Those are the pets where absolutely right away I am advocating for the use of prescription medication. It is not meant to be that I'm judging your pet. It's not meant to be a punishment. Our goal in doing that is that when they come in, we're really lowering their threshold for stress. You have the pet owners that's like, oh, my dog thought we were going to Starbucks and then we turned the corner and he knew we were coming to the vet. Like, they are so intelligent and they know those subtle cues, and we don't want them to have a progressively worse and worse response and memory to that. So those medications often will help.
So very warm welcome to Sarah Cortright. We're on the Pause and Effect podcast, and I've asked Sarah to discuss fear-free vet care and what that actually means. So welcome, very warm welcome.
Thank you so much. I'm so happy to be here. I know probably the viewers don't realize, but it is very late for me and very early for you. So
I know, to try and schedule these things with time differences, and I'm so bad at figuring out this, especially the fact that it changes in the US with daylight saving. It's a minefield.
Yeah, it is. It
thank
makes
you for
no sense
accommodating
to
it.
us. So, of course.
So you're a veterinarian, just to set the scene. And what is the kind of work that you're doing at the moment? Give us a little bit of information about you.
Yeah, absolutely. So my name is Sarah Cortright. I am a small animal veterinarian, and I work in the United States. I'm in California, specifically Southern California. So my main role is I kind of go from different hospitals. I work at several different locations, which I truly have loved because I've gotten to work with so many different people, see how so many different hospitals work. I am also the medical director for Underdog Community Project, which is a nonprofit based in Los Angeles. And our mission is really to provide completely free and comprehensive care to pets experiencing homelessness with their owners or in, displaced or temporary housing.
Oh, that is wonderful work that you're doing. Wow.
Thank you.
So our topic of conversation is something you haven't mentioned yet, and that is that you are fear-free certified. What does that mean? What does that mean to the way in which you practice? Please give us some more information about your qualification.
Yeah, absolutely. So fear-free is a type of kind of elective certification. I believe, if I'm not mistaken, it started in maybe like 2016. So it definitely is a newer type of practice, newer kind of ideology. When I was actually graduating from vet school, that was when clinics and hospitals first kind of started talking about it. And the main idea behind it is that every time that you have an interaction with an animal, and of course I'm talking about in a hospital setting, our goal is to always make it as positive as possible. And, of course, with saying that, there's always extremes to the circumstances. If a pet is coming in, and it's an emergency, we're not going to be like, okay, guys, let's work on our fear-free practices here because we just don't have the time to do that. But our goal is really to have a positive experience from moment one. So, for example, I had, a brand new puppy come in to see me today. And we really try to make that positive association for that puppy that is coming in to see us for the very first time, and really setting the tone and foundation for them that coming into the vet hospital, it shouldn't be a negative thing. Obviously, sometimes negative things happen, especially if they're sick, but really trying to set the pace that this is a positive experience for them. That way that can continue really for their entire life is our goal.
And that can really set up the future of the care that they receive. And I know that we'll go into some of those, the ways in which we historically have managed our patients, because not only are we dealing with fear in our pet patients, but we are fearful. And that's often why we put in some of these preventative measures in order not to be bitten and to be able to continue to do our jobs. Is that correct?
Yeah, absolutely. I mean, if you even look at the evolution of veterinary medicine, I mean, it wasn't it's crazy to think, but it wasn't that long ago where we didn't even consider, the pain level of pets, let alone the stress. I mean, for a long time, like when you think of farm animal medicine, they weren't even using like local anesthetics for pets. There was this, or for patients, there was this idea, not that long ago that animals can't even feel pain the same way that we can, which is obviously not true. And then once we kind of worked more towards their pain relief, then we started really connecting with their emotional experience. And to your point, how much our perspective of that situation can affect their emotions as well.
And that is so true. I think, we've come a long way. And do you feel that some of this has been driven by the relationship that people are having with pets? I've spoken quite a lot on the humanization of pets and the impact on pet care. Is this being driven by us as professionals, or do you believe it's been driven by owners' need for us to up our game?
Yeah, I truly think it's a combination of both, because I think, again, I mean, I grew up on a dairy farm. So we had, growing up, we had a dog that was outdoor only, and that was very, very normal. Very rarely, especially in the area that I'm practicing in, do we see, those kind of working or outdoor animals. A lot of our pets are in the home with us, and they're really like our children or our extended family. So I think pet owners are really coming in with that kind of understanding and those intentions for their pet, that they don't want it to be a stressful experience for them. And then I also think as veterinary professionals, we are talking more about stress in our pets. That's one of the things that Fear Free does help practitioners and staff identify, as well as kind of scoring those more subtle signs of identifying fear or stress or anxiety in pets. And that's something that I just don't think we were I'm not exactly sure why we didn't consider those things that long ago. It certainly takes more time for sure, but I think just the level of us caring and us understanding pets' emotions has really increased.
Definitely. And there are obviously practical things that we're going to discuss now about even starting at home before you get in the car. But before we go down that route, do you think that a lot of the signs that our pets display that may be indicating that they are stressed, even within the home environment, that are just owners are not aware. Owners are not aware that is actually a stress sign. Does it start with education of what the typical signs and symptoms or character traits that you have a stressed pet? Is that the kind of education material that you provide?
Yes, absolutely. So again, I work at a variety of clinics, and there's kind of a varying scale to what people say they do when they say, oh, we're a fear-free practice. There are fear-free exclusive practices where every appointment is like an hour long, because it really is a very intensive process. And then there are practices where they try to do as many fear-free practices as possible, but in a more limited setting. But some of those more intensive facilities, they will have a lot of resources for pet parents, and it really does start at home. So identifying some of those stressful triggers, a lot of it is conditioning, really setting the stage before you even leave the home, the night before, what we're doing for our pets to make them relaxed, to reduce their stress. It really does start even a day before the vet visit. So a lot goes into it, and really a lot of planning and a lot of communication and partnership between the pet owner and the vet professional as well.
Incredible. So what would you say are the key things that you advise owners, perhaps, starting out and maybe not necessarily that in tune with their pets yet? I know that there are probably various scales that owners, a bit like some of the clinics you're discussing, can go to really, and as we get better at it, we may, or as we are able to manage our time better, we may be able to institute. But what are the fundamental principles that owners can take away from this podcast discussion to say, next time, Dr. Sarah said, I need to prep the night before. What are the kind of measures that you're asking these owners to put in place?
Yeah, absolutely. So, I mean, speaking on kind of one end of the spectrum, so you have maybe a pet that is older or has a really bad history, so to speak, with the vet, where they're very triggered. Everything is very scary for them. Those are the pets where absolutely right away I am advocating for the use of prescription medication. And I always explain to the owner, it is not meant to be that I'm judging your pet. It's not meant to be a punishment. Our goal in doing that is that when they come in, we're really lowering their threshold for stress. Because again, we know so much more now. We have, I'm sure you have as well. You have the pet owners that's like, oh, my dog thought we were going to Starbucks and then we turned the corner and he knew we were coming to the vet. Like, they are so intelligent and they know those subtle cues. And we don't want them to have a progressively worse and worse response and memory to that. So those medications often will help. So for any of those pets, we will usually give medication actually the evening before and the morning of, or about 2 hours before the appointment time. The other end of the spectrum, again, maybe you have a new pet or a puppy. We're less trying to rewire and kind of desensitize them, but instead just trying to pair a positive association. So sometimes I'll even say, if you have kind of an earlier morning appointment, maybe don't even feed your pet breakfast. Bring in their food into the vet. That way we can feed them and they're already kind of food motivated. Bringing their favorite toys when you are traveling with them in the car, making sure you're not blasting music, trying to, really have a kind of serene and calm environment going in. A lot of hospitals that I've worked at, we will also have fear-free visits where the pet and the owner can come in and really just say hi to staff. The staff can give them treats. They walk around the hospital, walk around the lobby, and then leave. So it's really just trying to make as many positive associations as possible.
So leave with a good experience. Nothing happened, no injections, no trauma.
Exactly.
And then the next time, obviously, when you need to examine them, it's not so traumatic. Hi there, pet parents. This is Dr. Cara, the Ultra Pet Vet. I'm excited to introduce Ultra Pet's premium recipe for miniature and small breeds. Ultra Pet's smaller kibble size combined with calcium and phosphorus helps keep their teeth in tip-top shape. We've added omega-3 to support their heart function while keeping your little ones strong and healthy. Ultra Pet has included chondroitin, glucosamine, and green lip mussel extract to help your dog's joints and L-carnitine to manage weight. Prebiotics play a crucial role in maintaining a healthy digestive system by nourishing the good bacteria in your dog's gut. The best part? Ultra Pet offers a 100% money-back guarantee. Visit your local vet or pet store to make the switch now. So I'd like to get your opinion on how much owners can help and assist, rather than being negative and saying how much do owners actually contribute to their pets' stress. Because I think I have a lot of owners who really don't like bringing their pets, maybe because of their previous experience with another animal or their other dog, or the dog the last time they had to have something painful, for example. And so they come in uptight. What is the impact on their pets?
Yeah. And I think there can be a huge impact, because I think, and again, we've seen that. When I say this, I don't want to, again, sound like I'm passing judgment, because I will be the first one to say there are times when my baby is there and I am the stressed out pet owner, and my staff needs to be like, you're making it worse. Why don't we take it from here? So, we've all been there, but, I do think that, again, kind of having that communication with the owner, because I will go into a room, introduce myself, and really ask the owner what our goals are for the visit. How has our pet been before? And most importantly, what has worked best for your pet? Because sometimes we think, oh, if the owner could be in the room with the pet and they can hold while we're doing a vaccine, that might improve the pet's experience. And for some pets, that's absolutely true. For other pets, if they're kind of that have, where they're more protective of the owner, or they're more fearful, or sometimes just having them in the exam rooms, it's kind of claustrophobic for them, where we actually see that they do better in the back, and making sure we are communicating truthfully how the pet did, documenting that in the notes, and then making sure the owner is aware you are a part of this plan as much as we are, and we just want to figure out the best approach for your pet. And again, some pet owners are like, do not do a blood draw in front of me, I will pass out. We don't want them involved if that's the case. Other pet owners are happy to be there, and their pets truthfully do it is more beneficial for them. So really just laying out those specifics, having a lot of open communication, and knowing that it's not always going to work. But I think the worst thing that we can do is kind of, try to sugarcoat it, like, oh yeah, he was in the back and he did great, like when he didn't, because then it doesn't help the staff, it doesn't help the pets, and then it gives the owner unrealistic expectations too, because say they go to a different hospital, then they're like, oh, I don't know what you mean, like the staff never said that they had a problem with him, why are you telling me now that he needs medication or he's really fearful? So I think just kind of having that open and honest communication.
That is so true, because we want to give the best impression, and sometimes behavior for us, we're like, oh, they're considering how painful that was, or what I had to do. It was fine, but it doesn't necessarily mean that it's an adequate response for the owner, particularly for that dog. So it's so true. So how important is it for owners to make an appointment and to stick to the time of their appointment? And then to follow up on that, how important is it for us not to keep owners waiting? So if we can start with the appointment scheduling and how important it is for owners to make appointments rather than arriving and having to wait.
Yeah, so I think especially when, and kind of going back into how fear-free can work really well, but how it is very challenging to accomplish. So much of it is planning, and not just with the pet parent, not just with the vet, but really with the technicians, with the, customer service representatives. Even things like scheduling the time of the appointment can be critical. If you have a pet, for instance, that is very reactive with other animals, sometimes having them first thing in the morning, depending on if you have surgical patients coming in or what have you, that may work if it's, the hospital is kind of quiet, or that could be horrible because you have all the patients coming in at once. Those pets might do better right before lunch or more at the end of the day when it's a little bit quieter, there's less going on. So making that appointment and sticking to that time can be really important, especially depending on that pet's specific need.
So what are the key questions you would advise I inform my receptionist to ask when owners are scheduling the appointment? So you made mention of the fact that it's so important if you have a dog that is anxious to perhaps consider the scheduling time. What are the kind of questions that receptionists generally should inquire about in order to facilitate this?
Yeah. So truthfully, there are quite a lot. Again, there are some hospitals where we will actually kind of send a pre-appointment survey, and that's not just for medical records and vaccines. It's actually just a whole survey just about your pet's behavior. So some examples are they reactive to other pets? Are they aggressive on the leash? Are they sensitive to loud noises? Does your pet have any allergies? Because can we give them treats? Does the person at home have any allergies? Because sometimes hospitals will use things like peanut butter. So there's so many different, variations. And then of course, we're competing with all those things. And also we have to be practical as well and schedule a time that works for the pet owner as well. But I think, compiling that key information can be very useful. That way we already kind of know what the pet does well with. And then also the major red flags, like, this pet does not want to deal with any male doctors or male technicians, or there's something in the pet's past when they're held in a specific way. We know some pets are very shy with their head, so we would note that, or they have maybe an area that's painful, so to be sensitive of that. Are they coming in on any medications? Also, that way we can remind the owner to give them appropriately. So there's quite a long list. It is quite a process.
But these are really important questions that I think a lot of practice, certainly in South Africa, are failing to address. And that's the first step to, it's an awareness and a better communication with our owners to say, we want to get it right. And in order to facilitate this is the information that we need to make the experience better for you and for your pet. So really critical. And also, this, like you said, the staff have got to be involved. There's got to be an approach from all angles. It can't just be the vet who has an interest in sort of gentle restraint and handling, and then you've got the owner who's not bought into this concept. So a really, really valuable conversation, I feel, that you're sharing here. So thank you. We obviously have the waiting room, and the waiting room can often be a bit of a scary place, whether it's smells or visual stimuli or another dog that's causing tension, or even the mixed. I know a lot of practices are now trying to separate the dogs and the cats. And I mean, that just shows how far behind we are in terms of our consideration of fear-free practices within our clinics. So how are you advising us as veterinarians to set up our waiting room to best support these patients?
Yeah. So if possible, the ideal scenario is that you would never have dog and cat patients interact, period. And obviously that is, space allowing and with time constraints. But the ideal standard is that you would actually have a completely different entrance for cats and a completely different entrance for dogs, and you would have separate exam rooms for the two as well, because that way you don't have dogs barking that's scaring the cats, and then you also don't have the smells as well, or just them interacting even at a distance. And especially for our cat owners, I mean, a lot of these cats, my two cats as well, they're not going out of the house for really anything. So their first time out of the house, they're already in shock. You put them in this carrier, they hate it. They show up in this lobby. And then if you have a huge dog that's barking right next to them, they're just already through the roof, and your exam hasn't even started, or they're not even, fully in. They're still in the waiting room. And kind of going back to your question earlier, if that's not possible, then really preventing those wait times in the waiting room. And it if we can't have a separate entrance in those things, at least putting them into the exam rooms right away to try to minimize that excessive stress and that interaction between cats and dogs, for example.
Definitely. And we are familiar with some of and I find it quite strange because usually the cats are left behind, and, we practice a lot of things with our dogs, and then the cats come sort of secondary, which I'm delighted that we don't have in our practice. We've definitely are starting to cater and starting to understand cats a lot better. And, we have separate areas of the building that cater for cats and dogs, and very much they're separate from a noise perspective, smells, and allows us to set up our consult rooms, as you say, separate consult rooms, but even having the equipment in the facilities within those rooms and that space that is very cat specific, a cat scale, and so on and so forth. But I know that when we talk about environments, the cats obviously have very separate needs, and I know that we're becoming quite technical now. But how important are things like pheromones and covers and things like that in the waiting room and putting them up on a height? What is the impact of some of those practices that we are now starting to recognize as important?
Mm-hmm. Yeah, so I think it's, when we think about doing any one of those things, so pheromone spray, for instance, if that's all you're doing in a cat room, it's probably, it certainly isn't going to hurt, but how much is it really going to benefit the pet? But I I tend to see that really there's a cumulative effect with these things. So when you're able to keep the room cat only, you're able to use the pheromone spray. Maybe this owner also gave the appropriate pre-medications the night before. In the cat room, you have things like cat trees or a window and a place for them to kind of rest and sit up on. You have some treats available. It's really that cumulative effect that I feel has the most benefit. For dogs as well, having a more living room like environment. So one of the hospitals that I work at has a little couch instead of it being, just a hard exam table, having toys in the room, lots of treats for them. Some places will even have like noise machines to kind of cancel out the noise from the lobby. And all of those things together, I think, makes the most positive impact. And I also feel like just having it almost seem as normal to the pet as possible, because that's really the biggest barrier that we have in vet med, I feel, is that we just can't communicate with our pets. If we could somehow, reason or rationalize with them what we were doing, it would be a whole different story, but we can't. So mimicking their normal environment as much as possible and doing those things to lower their stress, I think is what is going to give us the most success.
I totally agree. So I want to go on to one of the things that I've seen you do on social media or share on one of your reels, and that is get down with the pets. It's actually meet them at their level. How important are some of the physical actions that you are doing now within your consult room, whether it's taking the time to treat them and reward them, but how important is it for us as veterinarians to be mindful of the behavior that we're displaying and the impact of that, let's say on our dog patients? Let's start with the dogs.
Yeah. So, I think the worst thing that you can do, and of course, from a customer service standpoint, everyone wants to go in and very loudly and be very bubbly and say, hi, this is my name and I'm here and I'm going to see your pet and I'm so excited. But for some pets, maybe if you have like a very happy and eager golden, that'll be fine. But if you have a scared, shaking little Chihuahua and you're going in very loud and kind of towering over them, that is the furthest thing from what they need. So again, depending on the level of comfort with a pet, I'll often try to go in very calmly. Oftentimes, especially if pets are really timid, I won't, make direct eye contact with them. I'll primarily look at the pet owner. I'll often sit on the floor, either kind of almost, having my body facing the same way as the owner. So I'm not, face on with them, offering the pet treats right away, even if that's, at a distance, whatever they're comfortable with. And then I'll really chat with the owner for a while as well. So before, I don't often go right into my exam. I'll kind of just talk with them. That way the pet can kind of suss me out as well and see, okay, what is this lady doing here? Okay, mom or dad seems okay with them. They're just talking. They're giving me treats. Not sure what's happening, but this seems okay. And giving them that second to kind of take everything in before we immediately move to a physical exam, which of course can be a kind of nerve-wracking experience for them as well.
Yeah. And how long are these appointments set for? Because you can't do this in 15 minutes. You can't give the time and space. How long is your ideal scheduling time for these fear-free consults?
Yeah, so it does depend on, the level for the pet, but really a minimum of 30 minutes, sometimes 45 to an hour. There are, again, kind of referral clinics where they will have 2-3 hour appointments. But it does also depend on the level of stress of the pet and kind of where they're at as well.
Very much so. So let's talk about the historical means that we would restrain our patients in order to achieve what we needed to, particularly when we just want to get the job done. And in some respects, the intention is to try and make it as brief and as pain-free and as efficient as possible. I want to get your opinion on the muzzles. In particular, because I know that we have the current feeling that using a muzzle is actually a means for us to be able to facilitate a lot of the things that we need to do and not be injured and not have the the patient or the pet unnecessarily restrained. So having a muzzle can actually aid in the work that we're doing. What are some of the newer thoughts on this, or are we just communicating the benefit to the owners and using the same techniques?
Yeah. So, I do want to say that as much as I utilize fear-free practices, my priority, will always be the safety of the pet, the safety of the staff. And I think, again, it really comes down to having the conversation with the owner. There are a lot of techniques that can be done to avoid use of a muzzle. So things like using, a towel to kind of secure their neck so they kind of can't turn. But that you're still safe and they're still safe as well. Using a cone or an e-collar so they just actually can't see you coming for things like maybe a rabies vaccine that's on their hind, and still distracting them with treats. But again, these things all have their time and place. I would absolutely never advocate for someone saying, we are never ever going to use muzzles again because we're trying to be fear free. And to be quite honest, I'm not sure. I am fear-free certified, but I don't work with the organization in any way. So I'm not like a representative of them. So I'm not sure what their official stance is on the use of muzzles, if it strictly says like to never use them. But for me personally, I do try to reserve them for those more extreme circumstances. And after I've already had a conversation with the owner, I think it should be used more as a last resort, but by no means am I advocating for never using them, especially when you have, again, those emergency situations. This isn't a puppy that needs a vaccine that we can try all these different techniques for. This is a dog that is having an acute crisis and we need to get an IV catheter in. So, but they definitely do remember these experiences. So we do also have to understand, are we really putting a muzzle on because the dog will bite us, or are we just nervous? And those are also the things that we really have to differentiate as well.
I totally agree. So now I'm going to go to our cat patients and ask the question, the controversial question about scruffing. To scruff or not to scruff? That is my question.
Yeah, I would say that's a pretty hard no on the scruffing. I do think that, again, I have worked in so many different hospitals, and even when before I was even in vet school, when I worked as a technician, a lot of older vets that I worked with, it was something that was done so commonly because we just, at the time, I think really felt like this is the safest way to prevent us from getting hurt. But I don't think we really understood the implications of the stress on the pet. And now we've come such a long way in understanding those implications, and also having better techniques and even just using medications to help calm those pets, where before scruffing seemed like it was maybe the only option possible.
So in order to, because I'm totally sold on this practice, which is why it's such an interesting conversation for me on a personal level, but for me to say, try and get the buy-in of other veterinarians, can we discuss the benefit for us as clinicians to having a pet that is fear-free, or having a patient more seriously that is fear-free, and actually trying to adopt some of these measures to manage these cases? Can you tell us what impact a stressful pet has on, say, the clinical parameters that we gauge during our consult?
Sure, yeah. So I mean, I think the biggest and most obvious one is that we can physically see a difference in those pets. So, I mean, when you think about a dog that is so stressed, that they're going to be panting, they're going to be hyperthermic, if you checked a blood pressure, it's going to be, through the roof, and whether or not that's real or because they're stressed. So even just, from the jump, those initial vitals that you're getting are probably skewed. And then when you think about deeper into that, the level of care that you're providing, it limits what we're able to do as far as a physical exam, because the pet is so stressed, and then you start getting stressed, and then you're not looking in their mouth all the way, or maybe you're doing a very brief auscultation of their heart because the owner's scared and you're scared, and everyone's just, everyone's nerves are just kind of high. It makes it harder to do even basic things like vaccines or getting a blood draw. And then you kind of mentioned this before as well. You have those owners that, truly are terrified to bring their pets in just because they are kind of fearful of what's going to happen. They feel like they don't have control of their pet, or they feel bad for their pet. So those pet owners are more likely to wait on an issue. Whereas if you have a very calm, stress-free kind of animal, oh, he has an ear infection, no problem, we're going to schedule an appointment. You have an owner that, oh my gosh, every time we bring my dog in, it's this whole thing. He's trying to, he's so stressed. For the next week we get him home and he's not acting normal. They might wait weeks on something as simple as an ear infection. And it's really acting in that way as a barrier to care for that patient.
I totally agree. And even the owner compliance in terms of managing the care of their pets, and you use the example of the ear infection. It's one thing saying, oh, your pet's got an ear infection, then they know that they're going to have to, or they feel that there's going to be a stressful requirement even at home in administering ear medication or a tablet. So, I mean, that support goes even further of completing antibiotic courses or providing adequate pain relief. And I think that, it has such a knock-on effect to either returning just to check and see how they're doing. They just don't want to repeat the experience, so they avoid it. And we do unfortunately see that. So true.
Absolutely. I mean, if you can't even get your pet in the door, let alone, how are you going to sit there and then, oh my gosh, now I need to,
sorry.
No, it's okay. It honestly startled me. Wait, now I need to see. Who is it? Now I need to see.
So, I'll send you a picture. We're kicking her out. So, sorry, Luke. So that is Xena, our practice cat, who's clearly fear-free.
No, I mean, I think that's an excellent blooper to have for sure. Are you at your practice right now?
Yeah. So this.
Wow.
So this room, when we did renovations in this practice, we'll do a little sideline thing. We did renovations in this practice because I felt really strongly. I can't say, and I have to be upfront about it, that We've always thought that we do our best for the dogs, but I've always recognized that there is a real deficit in terms of the kind of consideration for the cats, as I made mention of earlier. And so
for sure,
when I first took responsibility for this practice in terms of ownership, I started looking at some of and listening to little tidbits of CPD lectures where they were making mention of cat-friendly or cat-accredited practices, and I realized in our old cat ward, our cats would look at each other. So it was set up, and obviously it was perfectly adequate at the time because that's the information that historically they had available when they built the practice. But the cat patients we would have a situation where we go, these are two fractious cats and they are looking at each other, and this is a nightmare. So we would cover the cage. So I was always very mindful that if I was in a position to make any changes, I would want to separate the cats and dogs. The other thing about the cat ward was that it was next to the dogs, so they would hear the dogs, and we had a sliding door, but it wasn't adequate enough to block out the noise. And we had a table in there that was a stainless steel table, and when we needed to do something, the cats would be pulled, particularly a fractious cat, be pulled out of the cage and be placed on this cold, noisy stainless steel table. And there were so many things I was recognizing that we were getting wrong. So much so that I actively started putting things in place and just getting educated on what it meant to be cat friendly, from pheromones to the separate waiting rooms to offering the owners something with a pheromone-infused blanket to cover the cage while they were waiting, wait around the corner, ask the dogs not to sit in that area, because it's amazing when you've got a temperamental dog, they want to sit where the cats normally sit because it's out of the way.
I know. And it's crazy.
So when we took on more space, we actually set up consult rooms, and we have included in this, because we had a lot of people who didn't have access to a cattery that would be able to facilitate injections if, say, pets were on insulin or administering heart medication. And so I thought, when we take on more space, we're going to develop a luxury cattery for, a home away from home and a playroom. And Xena, we were recognizing she's a practice cat, but she's not getting adequate sunlight. So we made her a catio. And so we've definitely tried to put a lot of these practices, because we love cats, and into place, and we are seeing the benefits. We are really seeing the benefits, but there is still, and this is why I find our conversation so interesting, there is still a lot that we're getting wrong with the dogs. And I don't know why, because normally it's easier to put these sort of things into place with the dogs, that you would think if the cats would kind of come secondary, because they're a little bit more finicky. But actually, I think we're getting a lot right with the cats, and we're still struggling when it comes to meeting the needs of our fearful dog patients. So I think some of the things that you're discussing now are actually to get the buy-in of all the staff to say, you're going to be able to get that blood draw if you have a fear-free patient, rather than going, oh, well, we're going to have to try that later and we've blown multiple veins. We're going to be able to house them here without them barking all day. If they're sick and they need our care, those ones that go bark, bark, bark all day, if we are able to set up our facilities to better support these patients, we're going to get owner buy-in, and we're going to feel more comfortable about keeping them when they need to be with us. So many of the things that you are discussing here are really resonating for me, because we're getting things wrong. And I will make that admission live on this podcast, because, we can definitely be doing things better, even if it isn't, like you say, having 3-hour consult, which are just not, not feasible, but definitely for us to be considering ways in which we can institute some of these changes with some of the information that you're providing. So this is really, really valuable. So can we talk about, let's talk about separating the owner from, and how you have that discussion, because you made mention of the fact that there are times that owners facilitate the things that we want to do, like holding or we want to have them as part of the discussion and the buy-in. But there are times that owners, whether it's intentional or not, want to be part of the process and are actually not aiding what we're trying to do and actually making it worse. So what is the best approach for us to manage these owners, rather than upsetting them and saying, please, can you wait outside? And then they don't want to come back to our practice because they think we're rude.
Yeah. Yeah, absolutely. And I mean, I think again, the simplest approach always is really just to be honest with them. Like, I will often say, I'm noticing that your pet seems to be doing X, Y, and Z. So like, for instance, I'm noticing your pet actually seems to be doing much better when you're holding him. Do you mind continuing to do that? So then they're already feeling like, okay, like I'm helping this process. And then when I say, so now I'm actually noticing that as we're getting ready to do the blood draw, they seem to now be getting a little bit more fearful. And so maybe let's try this or redirect. And then if it's, still going on, are you comfortable with us maybe trying to bring him or her to the back and seeing if that works a little bit better to kind of get out of this environment? But I think just really stating what you are seeing when when good job owner, it looks like you're really helping. And when, I think actually they're starting to get too stressed in this room or in this environment. Let's try to give them a break and kind of reset and recenter. And rarely do I'm sure I could, think of a time that an owner was very, argumentative or really wanted to be a part of the process, of course. But I think when you just kind of explain to them that it's going to be more beneficial to remove your pet for these reasons, usually they're pretty accommodating to that. And some owners, again, when you're open and honest with them about, your pet did great with this, your pet did not do well with this, let's work on this next time. When they come in the following time, and then I preface with, how did your pet do last time they were here? What did you feel like worked for them? And they say, oh, last time we took him in the back for his blood draw, but we did everything else in here and he did great. perfect. Let's try that again. So just kind of establishing that, and yeah, making sure that the owner understands their role, I think makes a huge impact for them, as well as their pet, of course.
Definitely. So let's talk the best case scenario, because we discussed this right at the beginning. We said we've got that new puppy and this is their first time. And you made some mention of like taking the time and treating them and making the consult room as inviting as possible. But what are the kind of things that you are telling owners from a training perspective and sort of facilitating future examinations? Are you asking them to do particular actions at home to better prepare them for later on, those vet visits that are going to occur?
Yeah, absolutely. So, even it's almost like they are kind of assuming the role of a pseudo veterinarian at home. So, especially when you have a young puppy, the main things that I will tell them are everything that I'm doing here for my exam, pretend you're doing these things at home with your pet. When they are in a relaxed environment, they're at home. So things like looking at their teeth, opening their mouth, touching their gums, looking in their ears, just kind of gently patting them all over. Same with their paws, touching their paws, which is not only important for examinations, but of course, things like nail trims, gently manipulating their tail, things like that. And of course, with the understanding we're never doing these things in a forced way, and we never want to do them when our pet is already stressed. And even pairing these very, what seems like playful behaviors with treats or with rewards or with even just play. But if they can kind of create that scenario that for their pet to be examined, that's like a normal part of their routine, then when they're coming in for the vet visit and we're doing those things, they're like, oh, this is just like a game we play, or this is already what I'm used to. This is how I'm used to being handled, versus, I've never been touched there before. Paws. Yes, exactly. And then not only do they need a nail trim, but they also have something stuck in between their paw, and they're like, oh, no. And then, it turns into a whole different scenario. But that is really the best case scenario, is that you're getting a brand new puppy with brand new life experience to be had, and you can kind of set the tone for the things that they are already used to, really.
Totally agree. So can we go to the other extreme? We obviously are seeing our pets live a little bit longer, hopefully, and we're seeing a lot of geriatric patients, and their needs are different to, say, the puppy, whether it's previous experience that they've had, but often because they're painful, they're arthritic and sore. How are you advising owners to best support these pets so that they don't have those final vet visits that are fearful?
Yeah. And again, I think depending on what the owner is also inclined to do, because you may have a pet that's coming in that's a kind of a geriatric pet that has to come in maybe somewhat regularly, but has had very negative experiences. And maybe the owner isn't necessarily inclined to, we're going to make this dog love coming in here, but we want to make it at least bearable for them, or at least to the point where they're not shaking, or, as positive as we can make it. Those are the pets that I truly do advocate for use of anti-anxiety medication. Also making sure if you have a pet that is already on medication, specifically like our arthritis medication, you want to make sure that they are getting those medications the day that they're coming in, that we're not thinking, oh, do we not give them medication these days? We want to be very clear with the owner. We don't want your pet in pain, and we want to use these anti-anxiety medications that we have. Also for, older pets, hospital floors are like a nightmare for them because everything is so slippery. You're thinking about this older lab that has arthritis and it's just slipping all over the floor, using mats, putting even a yoga mat on the floor, anything that's like non-stick or they can grip on, with their paws as well. I mean, even those little things make such a tremendous difference. But definitely our older pets, it is kind of like you're saying, it is the other end of the spectrum, because they may have already had many negative experiences, but sometimes those pets are the ones that may be coming in the most often for, if they're getting any kind of long-term treatments. So it's equally as important for them to implicate these practices as well.
And it's never too late to actually improve the situation.
Absolutely, yeah.
So I know we are running out of time, which is such a shame because I'm so enjoying this conversation, but I didn't want to miss the opportunity to ask you to provide owners with some of the signs that they may not be aware of, they may be aware of, that indicate that their pet is stressed and that they need to manage the situation or ask the vet to manage the situation if the vet has not noticed. So what are typical signs that perhaps you can visually see?
Mm-hmm. Yeah. So starting with our cats, and truthfully, I think, I'm sure we could include it as a resource for, attached to the podcast, but Fear Free does have kind of two different categories for our cats and our dogs, of course, and then grading the intensity of that fear, anxiety, stress response. So cats, it can be more subtle things like the position of their ears, or their ears kind of forward, and just like you would see that at home, or are they really pinned back? What is the position of their eyes as well? Is there a dilation of their pupils? They even have like a little drawing to show like how their muzzle should be positioned as well. So those are very subtle things that you may or may not notice. For our dogs, I do feel like it may be is slightly easier, but, and I think you had mentioned this before, some behaviors, hopefully us as veterinary professionals are aware of, but even things like panting when the dog's mouth is wide open, and some owners will say, "Oh, it's so cute, he's smiling." Like, he might not be. I mean, he could be a happy, energetic dog that's panting, but he could also be a dog that is like very, very wide-eyed and stressed. The position of their tails, is it, wagging? Is it high? Is it tucked underneath them? So there's really these kind of very nice gradients that you can actually look at and document. And even then helps both the pet owner and the professional see, are we starting to see an improvement in these behaviors, at every subsequent visit as we're implementing these practices.
And a bit like the introduction of pain scores, which is relatively new for us, and it's things that we are including in our sort of consultations and in our hospitalized patients. We should be including like a fear score. Is there's something, resources out there you can direct us to?
Mm-hmm. Yeah. And I mean, the ones that I use are created by the Fear Free, them as a company. So they do have very nice, very clear and kind of objective things that you can see and help us not only for the pet parent, but for the staff, for the veterinarian, to score those pets. So we have a good marker of where they are and where they're going. Are we noticing an improvement? But yeah, there are very clear metrics that we can use the same way we would measure, a heart rate or a temperature for a pet.
I think this is incredible. And thank you so, so much for your time, especially so late in the day for you in the US. This has been really informative, Dr. Sarah. It's I think we need to step in the right direction, and not all of it is achievable, I know, with some setups of various practices, but there are definitely some things that we can implement immediately. It doesn't take major resources, not, like the vets, some are asking for dental x-rays or scopes or whatever. These are a lot of the things that we're putting in place do not cost money. They just take additional sort of time and intention. So it's been really, really informative, and I'm so grateful for all your insights.
Oh, thank you so much. Yeah. Thank you so much for having me. And yeah, I guess, that's really the idea that I would end on as well, is that if, you're hearing these things and thinking, oh, like that sounds cool, but like, I just don't think it would work. It doesn't have to be an all or nothing. Certainly, it would be great if we all had the time to have three 3-hour appointments during our day. But even like you said, starting with these tiny things first, making these very small, subtle changes, even just having these conversations with pet parents, it doesn't need to be, we're going to be 100% fear-free, moving on, but you can make those slow changes, even without really changing too much in your day-to-day practice, but you'll still see a huge positive effect for your patients, for their owners, and for your staff as well.
Well, I'm very excited to go and discuss this subject with my colleagues, and I'll definitely give you some feedback as to the response and some of the changes that we're putting in place after being informed. So thank you so much, Dr. Sarah.
Yes. Thank you. Thank you for having me.
Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.